Fantastic service, thank you. I've just got the mic. Good afternoon, ladies and gentlemen. Sir Peter, thank you very much for the generous introduction. And may I start by commending yours and Neil's leadership of the GMC over my period as Secretary of State. We've had a challenging year, but it has been a pleasure to work with you. And I particularly want to thank you for having a conference on medical professionalism, because I think that really is the theme of the year. And I think it's really important to spend some time reflecting on what it really means. And I want to start by thanking the NHS for the professionalism that I personally have encountered. Recently, both my children were born in the last couple of years on the NHS. I took my screaming one-year-old daughter to A&E a couple of weeks ago and to have a wound dressed. And as I sat down in St Thomas's, I've never seen a more startled nurse when she realised she was going to be alone in a room with a screaming one-year-old and the Secretary of State. But bless her, she did an absolutely fantastic job. And I've also had a minor operation myself shortly before I moved to health, and I was stretched out in the operating theatre at the Chelsea in Westminster. It was an operation on my head, minor operation. I was stretched out, and the local anaesthetic had been administered. The surgeon had his scalpel out, and the nurse looked at me and said, "By the way, Mr. Hunt, what is it you do for a living?" And I must admit, I froze, because I remembered that story of when Ronald Reagan was shot and he was wheeled into hospital, and he looked up at the Surgeon General and said, "Pray tell me you're a Republican." And the Surgeon General, who was actually a Democrat, rather nicely said, "Mr. President, today we're all Republicans." Anyway, I didn't want to risk having that kind of exchange, so I sort of rather muffled my response. But as I think everyone here will know, I don't come from a clinical background. And I think doing this job has been the most incredible privilege of my life, and I think probably is the biggest privilege I will ever have. But because I don't come from a clinical background, I felt a particular responsibility to go out onto the front line. And most weeks I try to go out to a different part of the NHS to see for myself what's happening. Not just a visit, but putting on the uniform, doing work as part of a shift. A few weeks ago, I washed my first commode. Thank you to the team in Harrogate Hospital for introducing me to that joy. But I've done T rounds. I've done nothing surgical, you'll be pleased to know. I've taken a few blood pressures and actually I have dressed a wound. Thank you to a very understanding nurse and indeed patient in Leeds. It is a wonderful thing to do. And the reaction I get from NHS staff on the front line is usually one of polite surprise, I think is the right way of putting it. And they usually try and say something nice, which can be a little bit backhanded, like they say, "You're much nicer than we thought you'd be," or something like that. But what I can say is the real impression that I come away with is just how hard people on the front line are working. And this is not, I think, an impression you get from reading the papers, but it is something that you feel. And I set up and ran my own business for 14 years, and I have to say that I don't think I've ever seen people in the private sector work as hard as I see people working in the NHS. And, well, I think it does deserve a round of applause, because I think it's very impressive. And I think it's, when I reflect on it, it is because I think there is something fundamental about human nature, that when you are, as a human being, confronted with another human being in distress or vulnerable or sick, it brings out the best in you. And I have seen some incredible care. I met a nurse who was caring for a man who was terminally ill. And without being asked to, this man had been separated from his family for 20 years. And without being asked to, she Googled his family, tracked them down in Ireland, and arranged for him to fly home and be reunited with them for the last 2 weeks of his life. And it was an extraordinary thing. I met an extraordinary manager of a dementia care home, and I asked her, a Polish lady, I asked her how she motivates her staff, because this was an advanced dementia care home, so most of the residents here weren't able to speak or really communicate. So it was a pretty difficult environment. I said, how do you motivate your staff? And she said, if I can get one of our residents to smile, they won't remember it the next day, but I will. And when I go home that night, I'll have an even bigger smile on my face. And I think it is truly humbling when you meet people who have that attitude to the care they deliver. And just to be a boring politician, I just want to give you some statistics that I think sum up just how hard people are working in the NHS. The budget for the NHS, as everyone here knows, was protected. It was one of the only budgets that wasn't cut. But on broadly the same budget in real terms, the NHS is doing around 600,000 more elective procedures every year, 800,000 more operations every year, more than 1 million people going through A&E every year, more than 2 million additional diagnostic tests every year, more than 4 million additional outpatient appointments every year on the same budget compared to 3 years ago. And I think that is a testament to the hard work of the people who work in the NHS. And when we talk about professionalism, I think there's one thing that sums up the professionalism of the people in the NHS more than any of that, and that is the reaction of the NHS to the horrific challenge of mid-staffs. Because in the last year, I have not had a single person in the NHS come up to me and say to me, you must realise that this was just an isolated set of problems in one hospital, in one town, and nothing like that happens at my institution. No one has tried to minimise that problem. In fact, I would say the opposite. I think people have come forward and said, it's not as bad as mid-staffs where I work, but even though I'm very proud to work at a fine hospital, I can say that I've seen things like that happening on my shifts, and we need to sort it out. And what I have felt so encouraged about is that as we have grappled with these problems, there has been no one saying that, we're making a mountain out of a molehill. On the contrary, because of that professionalism, that passion for what we do in the NHS, there's been a hunger to really get to grips with these problems and sort them out. And that is something I think we can be extremely proud of. And I want just to touch on what I think the main things are. And they do all revolve around this theme of restoring the professionalism that makes people join the NHS. But sometimes they find in the system they operate, it's impossible to do what they would consider to be the right thing for patients. So let me just divide it into hospital care and out of hospital care. First of all, for hospital care, I think there are really 4 things that we have concluded this year. And all of these things, incidentally, are things that I have picked up because people have told them to me, rather than things that I've dreamt up on my own. The first thing is around transparency. The NHS is a huge organisation, 1.3 million people. Bill Clinton said that politics is like working in a graveyard. There are lots of people underneath you, but they're not necessarily listening. And I think we have to, those of us who are leaders in the NHS have to remember that. But it is a huge organisation, and there will be examples of poor care in such a large organisation. And the most important thing of all is to be totally honest about it when we come across it. We must never have a culture where we are sweeping poor care under the carpet, or where we are discouraged from speaking out about it, as we heard in the earlier discussion. And that's really the thinking behind setting up a new Chief Inspector of Hospitals, Professor Sir Mike Richards, who's doing an extraordinary job, and asking him to and go around each and every trust in the country and tell us, just as Ofsted do for schools, in a language that insiders can understand, but also the public can understand as well, whether it is an outstanding hospital, a good hospital, a satisfactory hospital, or a poor hospital. And I think next year will be quite a frightening year for people working in trusts as they have their first inspections. Some have already had their first inspections. But the thing to remember, and this I think is the genius of the Ofsted system, is that we aren't just, and this was the sort of problem with the old system, we aren't just identifying poor care, we're identifying outstanding care as well. And there's a reason for that. It's because when we identify the problem hospitals, we also want to show them the way out of it, show them the ladder up which they can climb so that they're not a poor hospital. And you only do that if you, at the same time, identify outstanding hospitals. And one of the things to remember about every Ofsted inspection, and we model this on the Ofsted procedures, they don't just tell a school that you're a satisfactory school or you're a good school. They say you're a satisfactory school, but to become a good school, you need to do these 5 things, and they tell you the things to do. And the idea is that every school sees itself as being on a ladder of continuous improvement. So that transparency is the first thing. And then the second thing is transparency at a much more micro level, which is transparency about individual performance inside hospitals. And I'm so delighted that you were listening earlier to the inspiring Ben Bridgewater and the work that Ben did with Bruce Keogh in pioneering transparency of heart surgery survival rates is a world first. And we are now the first healthcare system as of this July anywhere in the world that is, has extended that transparency to 11 different specialties. And we're looking at the possibility of extending it to cancer and other non-surgical procedures as well. Now, it's a very fraught process, and there's the complexities of risk adjustment, and we obviously got to be careful that we don't deter anyone from taking on the more complex procedures. And we won't get there all in one go, but this has the potential to make the surgery and the procedures that happen in this country the highest standard anywhere in the world. And it's because we have a national health service that we can do that in a way that not only is much harder to happen in America, but it's pretty hard to happen in countries like Germany and France, where you have so many different providers in the system. So that, I think, is really important. Then I want to talk about what Sir Peter mentioned, accountability. I think in too many parts of the system, the focus has been on volume and throughput and targets, and not on actually making sure that someone is responsible for doing the right thing for patients. And that's why the idea of, you know, going back to having the consultant's name above the bed, the responsible nurse above the bed, is so important. And I want to challenge the acute sector to go beyond just putting a name above the bed and to think whether, in fact, there should be a responsible consultant for someone's entire hospital stay, so that they don't just move from ward to ward and the consultant's name changes, but actually there is someone who is thinking about someone's whole stay. Every day I try to read one complaint from a member of the public about the treatment they've received on the NHS, just to remind myself of where problems happen. And sometimes they usually are pretty shocking, and I always remember that these are only a tiny minority of cases. But there was one example where someone from Stoke had lost her husband after about 16 months of treatment on the NHS. And the detail that stuck in my mind was that he had gone into hospital in January and he was having diarrhea dozens of times a day. And it wasn't until November that he actually had the operation to deal with the diarrhea. And what had happened was that someone had done a test and said, come back in a month when we have the results from the test. And someone had looked at those tests and said, I think you need to do another test, come back in another month. And then he'd come back and seen a different doctor. And the result of all that shuffling around was it took 10 months for him to have the operation he needed, because no one had actually stepped back after a couple of months and said, hang on, let's just solve this problem. What is it? And let's get to the bottom of it, and let's get this person the procedure they need. Now that, as I say, is a very rare occurrence, but it does happen, and I think we do need to think about that accountability. And then the other thing in hospital care, which I think has been a big lesson this year, is candor. And I'm pleased to hear that you've been talking about that. And I think, look, it's one of the complaints about the GMC this year was why weren't more doctors struck off more quickly from mid-staffs. And I recognise that we do need to have a system where when there is egregious behaviour, there is a speedy process. And I welcome the fact that the GMC are going to try and deal with all their cases within a year. And I think the public need that reassurance. But I think we kid ourselves if we think the way to solve the problems of mid-staffs is to get rid of more doctors or more nurses. It's actually the opposite. What we need to have is a culture of openness and transparency, which is actually a no-blame culture, because the vast majority of mistakes don't happen because someone was grossly negligent. They happen when someone was trying to do the right thing but made an error. And I think it's really important that we understand that difference. This is, I think, the great insight of Don Berwick's report in the summer. And I studied what happens in the airline industry before concluding the right way forward on this. I happen to be a part-time football referee, and one of my linesmen was an EasyJet pilot, and I was talking to him about the way the airline industry has so dramatically improved its safety record. And he said that the real reason was because pilots have an incentive to report things. They actually get legal protection if they report things. If you think about the cockpit of a plane, it is the almost perfect condition for collusion. If you have a near miss, all you've got to do is to look over to your one other person in the cockpit and say, that never happened, did it, Bob? And yet they've dealt with that in the airline industry, because Bob knows that if there ever came a professional conduct hearing, the fact that he's reported that incident will give him protection, which is why I'm so delighted that the GMC and the NMC have agreed to change their professional guidelines, first of all, to strengthen the professional duty of candor and make it clear that that applies to, as it were, near misses, cases where harm didn't happen but might have happened. But also that if you do report things, and this is what Charles Ellis was saying just now, if you do report things, then you have some protection, and that will be considered as a mitigating factor if there was ever a professional conduct hearing later on. And I think the reason for that is because we want to create a culture where we are learning from mistakes and improving, and people feel able to speak out. And I think that is one of the biggest lessons from mid-staffs. Briefly, the same lessons apply to out-of-hospital care. That's why what Steve Field said this morning in his first wave of inspections about GP surgeries is so important. It's really important to have transparency. Accountability, I think that's perhaps the area where we have most missed accountability. It's actually not what happens in hospitals. It's the losing of that personal relationship between GPs and the people on their lists. And that's why I'm so delighted that the BMA have agreed to restore named accountable GPs for the over 75s from next April. There's a long way to go in implementing that, but I think that will make a big difference. And then I think the other thing that we can do to restore that accountability is to make sure that we have properly integrated services so people know where the buck stops. I just want to conclude, if I may, with a thought. I was in China with the Prime Minister last week, and I had a day at the end where I didn't have a very heavy program, and I hope you'll forgive me, but I sneaked in something non-medical onto my program, which is a tour around a temple in Chengdu. And the chief monk was showing me around, and I said to him, what advice would you give to political leaders? And he said, lead by morals. And I thought about the NHS because the NHS is a moral being, or it's nothing. And we have to remember that, and that means always finding a way to put the patient first. And I think always remembering why the NHS was set up 65 years ago and why we're so proud of it. It was set up with the vision that no one should be denied the best health care because of their income, their age, where they live. All the things that make us different shouldn't impact on receiving the highest quality healthcare. And we are proud in this country to have built the fairest healthcare system in the world. But that original vision was not just about equity, it was about excellence as well. And we need to recognise the fact we have far too much variation in the NHS between the best and the worst. And we need to make sure that everyone is confident not just of access to healthcare, but access to good quality healthcare. And of course there are huge challenges, but we have the great comfort of knowing that this is exactly what every single doctor and every single nurse in the NHS wants for themselves, for their job and for their career. And so in a week when we're all thinking about Nelson Mandela, let's remember a comment I said yesterday at the Dementia Summit. Let's remember one of his great sayings. He said, "It always seems impossible until it's done." And I think we can do this, and I'm absolutely determined we will. Thank you very much.